Jeremy Corbyn's NHS reform plan was left in tatters after analysis found it would leave the health service billions of pounds worse off. Labour is promising a £40 billion cash injection by 2024, a real terms hike of £26 billion. But the party's plans to introduce a 4-day working week would wipe out the benefit and mean the budget was effectively cut, according to the Conservatives. Health Secretary Matt Hancock said, Labour have let the cat out of the bag. They won't increase the NHS budget, they will cut it. This is further proof that they aren't fit to be in government. Jeremy Corbyn's plans for a 4-day working week will cripple our economy and cost the NHS billions every year. That leaves a huge funding shortfall in Labour's plans, and it is patients who will pay the price for Corbyn's incompetence. Corbyn's Labour also have no policies to deal with the pressure that their plan for unlimited and uncontrolled immigration would put on our NHS. The Tory analysis found that Labour's pledge to push up funding to £129.30 billion next year would be reduced to £123.20 billion once the cost of a 4-day working week was factored in. Conservative plans would put funding at £127 billion in 2020. The party claimed Labour would leave the NHS worse off by £5 billion over the course of the next parliament. Labour has insisted it would phase in the plans to cut employment contracts to 32 hours weekly, and the reforms would be negotiated sector by sector. The party warned the rich they will pay more to cover the cost of the so-called NHS rescue plan. Shadow Chancellor John McDonnell said the 4.3% funding increase for health spending over the next 4 years would be paid for from Labour's proposals to reverse corporation tax cuts and tax the wealthiest people in society. The party said it will focus on prevention measures to stop people getting sick and tackling health inequalities. Mr. McDonnell is expected to say, the world-class health service we all need and depend on needs proper funding. Labour's policies to tax the richest in society and invest for the future through our Social Transformation Fund mean we will be able to improve millions of lives, but the Institute of Economic Affairs said the funding plans were irresponsible. Mark Littlewood, Director General at the think tank, said, the endless billions of pounds that are being pledged to the National Health Service in this election cycle are not costed, not responsible, and crucially are not going to cure the health system's long-term ails. The NHS remains an international laggard in terms of health outcomes and has some of the highest rates of avoidable deaths in Western Europe. Niall Dixon, Chief Executive of the NHS Confederation, which represents organisations across the healthcare system, said further details were needed from parties about their plans to tackle the crisis in social care.